This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health, you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
And this month on Mon Health Talk, you're probably going to catch on to the theme. February, hearts, cardiac. See where we're going with this today?
It's Heart Month.
Aha! Makes a lot of sense, doesn't it? Joining us in the studio is Dr. Samantha Kreitz, cardiologist at Mon Health Heart and Vascular Center, specializes in cardiac imaging. She joins us in studio this morning. Good morning, Dr. Kreitz.
Good morning.
How you doing?
I'm doing good.
Are you ready for Heart Month?
I'm super excited about Heart Month.
Well, tell us a little bit about yourself before we jump into the meat of this conversation. Where are you from? How did you get into all of this?
I grew up in Cowan, which is a small town in Webster County, West Virginia. I fell in love with hearts when I was in probably about 7th or 8th grade. I saw a documentary on Discovery or some channel on TV and just fell in love with them and decided I wanted to be a cardiologist.
When did you join Mon Health?
Amazing.
Do you like that?
I love that. I love
story.
that story.
I joined Mon Health in 2017.
How did you get to Mon Health? Where did you go to med school? Did you have to go out of state? Did you stay in state?
No, so I did my undergrad and got a master's in exercise physiology actually through WVU. And then I went to the West Virginia School of Osteopathic Medicine for my medical school. Then I came back to WVU for residency and fellowship, where I completed my fellowship in cardiovascular medicine. And then I actually went to UPMC and did a 4-month fellowship in cardiac MRI. And then I came back and started at Mon Health.
You know, Sarah, it's February. We said it's Heart Month. And a lot of times we sit around and we think when we talk about heart disease and heart health, usually it's us guys that get the bad rap because we don't eat well, might be a little bit on the heavy side. Not trying to talk about anybody I might know personally, but it's also a focus, and I think a lot of times women's heart health gets lost in that conversation.
Yeah, I think so. Can you talk to us a little bit about that? Is this an issue that is more specific to men, or is this something that's for everyone?
It's actually for everyone. Heart disease is the #1 killer among men and women in the United States. And people, like you said, seem to think it's a men's health problem when actually it's both. So it is the #1 killer of women as well.
And I want to talk for a second about what some of the symptoms may be, because I know obviously our bodies are very, very different, men's and women's. And so I think that there could be some other symptoms. But I also want to talk for just a second. I want to back up a little bit about heart health in general and the fact that, I mean, is heart health something, and the fact, to me, it's staggering to see some of the numbers and to learn that it is the most common cause of death for men and women in the U.S. Is that something that is somewhat preventable?
To an extent, yes. A lot of it plays into our diet and our activity levels. You know, you can't outrun your genes. So if you have a strong family history, then you have a stronger chance than someone who doesn't. But if you don't smoke and you diet and exercise appropriately, you can cut your chances.
Cut your chances down. So whenever we are talking about women in particular, are there some different symptoms that you may see in a woman than you may see in a man? I'm speaking selfishly here, Dave. I want to know.
Go ahead.
Yeah, so women can have the typical symptoms as well, such as, you know, the crushing chest pain that radiates up into the jaw and down the arm. Women can have that, but they also, and men can also have other symptoms, which can be nausea, vomiting, pain between the shoulder blades, you know, isolated tooth pain, or, you know, overwhelming fatigue, dizziness, sweating, that kind of stuff. So those are other symptoms to be looking for in women, but also in men.
It's funny. If I had tooth pain, I would go to a dentist. It wouldn't occur to me. So is this something that I could be coming and doing regular checkups? Like, how would I know that my tooth pain is something I should speak to a cardiologist about versus a dentist?
So usually the way that happens is someone does go to their dentist, and their dentist checks out their teeth and says, everything's fine. And then they start thinking, oh, well, you know, I do get this tooth pain when I climb upstairs. You know, well, that doesn't make sense, right? So that could be
Right.
a sign that it's
Interesting.
your heart.
I was going to ask kind of the same question is, people who work out, believe it or not, I do go to the gym once in a while, but you end up and you go, oh, I lifted too heavy today. I must have done something to my back, or, oh, I went too heavy on the bench press. I pulled a chest muscle. How do you know the difference? How do you know when you need to go get this looked at versus, oh, I went a little too heavy on the lift today?
Right. Honestly, most people that work out's going to know the difference because they're going to be used to that pain.
Sorry, that was funny.
But something
I don't know what she's implying there, Sarah.
something that you can think about is, does it hurt when I move? Does it hurt when I flex those muscles? Does it hurt if I move my arm? That's more likely a musculoskeletal pain versus a heart pain.
And if it's continuing on versus a soreness that goes away, is that a piece of that too?
Right, yes.
Okay, that makes sense. What are you looking at me for?
I don't know what you're trying to imply on that side of the desk.
I don't think anybody's implying anything.
We're talking to Dr. Samantha Kreitz. We've got to squeeze in a break focused primarily on women's heart health today. It is Heart Month, of course, February. Makes sense? Hearts?
Does.
Valentine's Day? All the above? We'll continue the conversation next. It's Mon Health Talk. Talking to Dr. Samantha Kreitz this morning, cardiologist at Mon Health Heart and Vascular Center, specifically focusing in on women's heart health. Before we get back into that, I do want to ask you a question because you specialize in cardiac imaging. Now, it sounds self-explanatory, but what is cardiac imaging? What are you doing exactly?
So primarily my focus is taking pictures of the heart in one way or another, either transthoracic echocardiogram, transesophageal echocardiogram, cardiac CT, and cardiac MRI. Those are my main focuses. I don't
Big words, but it's taking pictures of the
taking
heart.
pictures of the heart.
Okay.
Yes.
I said it in self-explanatory, but it interested me because what do you learn when you're able to take a picture, when you're able to get an image of it? What are you looking for? What are you trying to learn from that?
It depends on which modality we're looking at. The echoes primarily look at the heart function and the heart valve function, seeing how well the valves are working. Are they leaky? Are they stiff? Are the chambers working like they should? Are they normal size? The CT, we can look at those things as well, but it's primarily looking at the arteries around the heart. So it's kind of like a heart cath, but without going to the cath lab and just doing a CT scan. And then the cardiac MRI, you get a lot more information about the heart muscle specifically. Is there any evidence of infiltrative disease, scars from previous heart attacks, or other infiltrative diseases, things like that?
It's amazing. We've talked about this pretty much on every Mon Health show so far this year. How far technology has taken us, the fact that you can do that and you
it's
don't have to
amazing.
go internally to do it is just absolutely wild to me.
Yeah.
And so incredibly helpful in helping us understand these things.
Yes.
So again, we're talking about more specifically women's heart disease because again, I think that there's some misconceptions out there about heart disease or heart issues in general being more specific to men. And you were mentioning actually it was Go Red for Women. Was that last week?
This past Friday.
This past Friday. Okay. And again, trying to help bring some awareness to the fact that there are certainly heart issues for women. And we've already talked about some of the symptoms. I want to talk now a little bit about some of the heart disease factors for women. Can we talk a little bit about everything from, and I'll say the M word, menopause to, the basics of high cholesterol, things like that?
So first with menopause. So when you're a younger woman and you're still having your menstrual cycles, that actually protects you somewhat against cardiovascular disease, at just the high estrogen levels. So once you hit menopause, your risk actually becomes that of what a man's risk is at that point. So if I'm ever doing your stress test at the hospital, I'm going to ask you, hey, have you went through menopause yet? Because it's a risk factor if you have. And then as far as cholesterol, we have risk scores that we determine if you need to be on cholesterol medicine or not, based on, other factors. Do you smoke? How old are you? What's your cholesterol levels? Do you have diabetes? Do you have high blood pressure? And based on those scores, then we determine what your optimal cholesterol should be. for instance, a young healthy person without any other risk factors, their LDL, which is the bad cholesterol, we want less than 190. But if you have risk factors such as diabetes, high blood pressure, things I mentioned before, then we want your LDL to be closer to 100, if not 70 or less.
So whenever we're talking about these things, and again, so menopause tends to come with a particular age. As we talk about women's heart health, are there certain ages, or is this, should everyone be taking this seriously?
Well, just like everything, even with men, once you get to be, middle-aged, that's when your risk starts going up. But I think our lifestyle when we're younger plays a large role into that. So I think everyone of every age should start paying attention. Even, middle school children, elementary school children, we need to start teaching diet and exercise early to help prevent troubles later in life.
And it is amazing, and we talk about this a lot, especially being in the state of West Virginia. We talk a lot about our obesity rate. We talk a lot about how doing these, especially childhood obesity and those long-term effects, and seeing very young people having very serious diseases that are caused from just poor diet and nutrition, and some of the other factors that could be used to help reduce the risk of heart disease. Talk to me about what some of those are. How could we help to reduce some of these risks?
About obesity, for instance, if we cut down on the amount of sugary snacks that we're eating as adults and children, making sure that we're getting higher amounts of fruits and vegetables, less processed foods, eating whole foods, that's huge. And like I said before, if you teach that at a younger age, then you will continue that through your adulthood. But it's never too late to start. So, I was raised on lots of processed foods, and I made a change and said I'm only going to start eating healthy and start exercising. So that's a huge thing that you can do just right off the bat, is just change your diet. Eating more whole foods specifically. And then, we always recommend at least 30 minutes of physical activity a day. And if you can't get your 30 minutes right off the bat, then start slow. Do 5 minutes of walking, or, and then build up to 10 and then 20. And we're not talking about running marathons. We're talking get out, walk around the block for 30 minutes.
Take the stairs that day instead of the
stairs,
elevator.
Yeah, exactly.
Yeah.
Just start moving. Yeah.
We're talking about women's heart health this morning. Dr. Samantha Kreitz joining us in studio. We'll continue that conversation on the other side of this break. It's Mon Health Talk on WAJR. Couple of more minutes here in studio with Dr. Samantha Kreitz, cardiologist at Mon Health Heart and Vascular Center, talking about women's heart health this morning. Sarah?
Yes, we are indeed. And again, we're talking about this because it's Heart Month, and there's a lot of perceptions out there about heart health being a man issue. And that's simply not true. We know that in the United States, heart disease is the most common cause of death for both men and women. So we got to talk a little bit right before we had to go to break about reducing the risk of heart disease. And we talked about exercise, diet. Those are the main things. And you know what? There hasn't been a show we've done yet where that isn't where everybody was told to start. So I do want to emphasize that when it comes to overall holistic health. But some of the other things that I really wanted to make sure we hit on, in particular, smoking. Talk to me about smoking and how that impacts the heart.
Smoking is a huge risk factor. Sometimes that'll be their only risk factor, and they'll come in with a heart attack. They'll be healthy otherwise, no diabetes, lean, physically active, but they smoke. And they'll have a heart attack. So that is a huge risk factor. And if you can stop smoking, that will cut your risk dramatically. And just touching base on it real quick, it's the e-cigarettes. They are also terrible for you. So I'm not encouraging people to switch from one to the other. Quit it all together.
And whenever it comes to smoking, and if you're somebody, let's say you've smoked for 20 years, is it still better to quit now to help protect your heart? Or at that point I hate to say, is the damage done, but is it still better to make that change in your life?
Yes, absolutely. Once you quit smoking, I don't remember the statistics or data now, but there's a certain period of time where you will go back to your pre-smoking risk. to
Great.
like someone who's never smoked before.
It's not too late.
It's not too late.
And that's so important. So, and again, just hitting one more time on this because you were talking about it, whether it be smoking or some maybe hereditary things. We also have a perception, much like, oh, well, this is a man's disease. We also have this perception about, well, that person's skinny,
right.
so they can't have heart disease.
Right.
That's not necessarily true either, correct?
No, absolutely not. Like I said, we'll have patients who will be marathon runners and vegans, and they'll come in with heart attacks. Like I said before, you can't outrun your genes. There are some things you just cannot change, but being overweight is absolutely a risk. So, losing weight, diet, exercise, not smoking, that kind of stuff is what you can do. But there is a perception that skinny people don't have heart disease or diabetes, and that's just not true.
Right. All right. So if somebody is listening and they are maybe wondering, do I have some of these symptoms, or what can I do to make sure I'm protecting myself? How can Mon Health Heart and Vascular actually help the patients?
So they can come and visit us, and we can assess their symptoms, assess their risk, like with those scores that I was talking about, and determine, do they need to be on an aspirin or a statin. We can do, if you're in that intermediate risk, we're like, I don't know. You can do a calcium score to see if there's calcium actually in the arteries around the heart with a CT scan, and then determine if they need to be on a higher intensity therapy at that point.
Okay.
So they should absolutely give us a call, and we can assess them.
Do they have to get a referral? How does that work? Do you need to get a referral from a primary care physician? Or
I think that depends on their insurance.
Okay.
Because I've had some patients self-refer and they get right in, and others need a referral. So I think it has to do with their insurance.
All right, so that's something you'll have to figure out there on your own.
Right.
But yeah, ask those questions. And whenever you are having your next appointment with your primary care physician, make sure to talk to them about anything that's coming up. Again, the body is connected. So you were talking about you may have a tooth that's hurting, and that could potentially be a symptom of heart disease.
Right.
It's important to mention all of these things so that your primary care physician can also help to make the appropriate referrals as well.
Yep.
All right. Well, for anyone that is interested in finding out more about the Mon Health Heart and Vascular Center or Dr. Kreitz, you can always visit monhealth.com/heart. And again, this is our Heart Month. And so we're going to be focusing each Monday here in the 8:30 Mon Health Talk Show about various ways to be protecting your heart.
You're going to hear this for the rest of the month. Let me just sum it up. Ready?
Yeah.
Quit smoking, eat right, and exercise.
Yeah.
And you'll never have to see Dr. Kreitz. Although she's very nice. I don't know why you wouldn't want to come by and stop by for a visit.
Show, but that's all right.